I want you all to imagine going to your doctor with symptoms of pain, stiffness and exhaustion to get some medication. Now I want you to imagine going months, seeing no improvement in your symptoms, yet you're now suffering from horrible, debilitating side effects. This is a situation all too familiar for people that have rheumatoid arthritis. This is a disease where the immune system attacks the joints, causing long-term inflammation and pain, and it requires long-term treatment. It also increases a person's risk of cardiovascular disease, infection, anxiety and depression. Now we're lucky, there are actually a lot of drugs out there to treat this disease which work well, yet no way to identify who will respond to what. While people present with similar symptoms on the surface, the way they respond to treatment is an individual thing. And at the moment, it's trial and error to get the right treatment or combination of treatments. And for over 100,000 people in the UK alone, they will not respond first time. And during this, and it can take years to get the right treatment. And during this time, there is irreversible joint damage occurring in that person, which we know has a long-term impact on their life, mentally and physically. So there is an urgent need to find a way to predict treatment response in rheumatoid arthritis. And that's where I come in. I'm interested in finding a biomarker from the blood. And a biomarker is simply something that we can measure and test for reliably in someone. Specifically, I'm interested in a biomarker called a chromatin conformation signature. Chromatin meaning DNA, conformation meaning the shape of that DNA, and signature meaning a group of these DNA structures. So we can think of our DNA a little bit like a set of earphones stuffed inside a small pocket. This means our genes are not linear, but in fact they often adopt this looped structure due to the way the DNA is packaged in a cell. Now it's been found that 5 of these gene loops have shown great potential to predict response to one of the most commonly used drugs in rheumatoid arthritis. And my job is to find out a little bit more about this. Is it stable over time, or do we have a time frame that we need to test for this biomarker? And are these 5 genes capable of predicting response to the other treatments? And if not, what are the 5 gene loops that will? So to do this, I have access to samples from a biobank of patients before and during treatment. And I do a technique in the lab, which essentially allows me to take a snapshot of what these gene loops look like at a particular point. So by taking samples at different points along a treatment course and using samples of people treated with different drugs, I begin to answer these questions. So I think my research is fundamental, and I really hope that it's going to contribute to the availability of a biomarker in the not too distant future, meaning that everybody will respond first time and therefore lead a much better quality of life with this disease. Thank you.